Welcome back. As we've been reporting, things are looking up for sports fans. The Major League Baseball season has begun. The NHL playoffs just 8 days away. But what about those COVID concerns? Joining us now from the two NHL hub cities, that is just a coincidence, infectious disease specialist Dr. Lenora Saxinger and Dr. Susie Hota. And Dr. Saxinger, let's begin with you. And you're in Edmonton. And how are you feeling about the safety measures the NHL has put into place?
You know, from what I know of them, I really think they've tried to find that balance between having something that's workable and as safe as possible. There had to be a few compromises, I think, in terms of the length of quarantine, because you can't really quarantine players for 14 days and then ask them to start playing aggressively. So they're kind of trying to find a reasonable middle ground with testing and really adherent use of bubbles and extra precautions before coming here. So I actually think it looks reasonable. I think it'll be a good test of whether it's possible to make this kind of endeavor safe, because I think they've designed it as well as possible.
Dr. Hota, strictly from a medical perspective, not from a sports fan perspective, let me ask you this. If a player or a staff member who's inside one of those bubbles tests positive in either Edmonton or Toronto, what would the implications be of that?
Well, I think that you'd have to approach that very much like you would in a higher risk setting, like a hospital or an institution where you can have potentially a pretty rapid spread. I think one of the challenges that they can't really overcome is that the players can't be masked at all times, especially while playing. So if there is a positive case, you would have to pretty aggressively go into what we call contact tracing and try and find all those individuals who are in close contact with that person and potentially quarantine them depending on what that contact is like. So that's going to be really critical.
And what about the possibility of false positives? I guess that complicates how the reaction would take place.
Yes, I mean, I think that's always a concern, and that risk goes up as the prevalence or how common the disease is in the population is lower as it goes down. So there's always that possibility that there could be a false positive test result. But I think to be cautious, we probably want to deal with it as though it may be a true positive and act on it that way.
So, Dr. Hota, hockey is going on in Canada. Major League Baseball, on the other hand, won't be in Canada. We know the Blue Jays will have to stay in the United States, playing their home games in Buffalo. But just generally, as you consider what Major League Baseball is doing with team members going from city to city to city, obviously that, and in the United States, that presents a much higher level of infection risk.
Yes, that is a concern. I mean, thankfully here in Canada, we won't have to worry so much about that. But, for those players that are going from one area of the U.S. to another, I mean, there are vast differences in how much COVID is occurring in different parts of the U.S. So I think that would be a big concern of mine, is they could be traveling into areas of real high risk and then into other areas and potentially importing it into that area and of course, exposing themselves to that risk.
Dr. Saxinger, these sporting events are going to be on TV. Obviously, no fans in the stands, but a lot of us like to watch hockey games and other games in groups, backyards on a big screen at a pub. What concerns do you have about that?
Well, I think that we're seeing that transmission in the community right now. We're seeing a lot more outbreaks related to bars, restaurants, even patios, where they're trying to follow all the rules, and outbreaks related to backyard barbecues and garage parties. And so I think that just really, really reinforces those basics of the distancing, the outdoor spaces, masks if you're not eating and you're indoors. And I actually would say that I would vote for the large screen backyard and nicely spaced lawn chair option far above going to a pub, because I think that we're still trying to find out that kind of safest space where we can get some social interactivity without excess risk. And of course, the option of just watching it together and communicating over Zoom as you watch, or some other virtual manner of kind of bantering and watching together, would be the safest one of all, with takeout food.
One last sports-related question I'll ask each of you in maybe 30 seconds each, and that is about amateur sports, the kind of sports we might get involved in this summer. Dr. Saxinger, first to you, what should we be keeping in mind?
Well, I think that one of the big questions with sports have been that if there's an element of contact, is a brief contact, like less than 15 minutes, but if you bump into someone playing basketball and they exhale into your face, is that going to be a high-risk contact? And I don't think we have an answer to that. So I would suggest that people favor sports that are at a greater remove and you're less likely to have that face-to-face kind of exhalational contact. And I'm still very cautious about indoor sports in enclosed spaces because that's been shown to be a source of outbreaks because people's breathing kind of disperses more possible transmission droplets when you're breathing heavily in an enclosed space. So outdoors is best, and track and field would be excellent.
And I'm only laughing because I can't imagine myself being involved in any kind of track and field event. And Dr. Hoda, last word to you. What else should we keep in mind in terms of our own sports?
Well, I think a couple of things. I agree with all those things as well. And I think, you might want to consider just having a smaller pool of people that you're playing these sports with so that you're not exposing yourself and them to others, a large number of people. Being outside is always a great idea, and maybe keep them at pretty brief, short stints.
Great talking to both of you. Thank you very much.
Thank you.
Welcome.